Hello everyone. Today I'm going to talk about how to tackle the Step 3 exam cases. I went over in another video what the structure of the Step 3 exam is like, so make sure you check that out and see my other videos on how to study for the Step 3 exam and what resources to use. So first of all, when you start your case, you're going to see a prompt. It will tell you the history of the patient. For example, 60-year-old man with sudden onset left-sided chest pain presents to the emergency department, and it'll give you some more information on that, as well as his past medical history. Is he diabetic? Did he have any other medical conditions? What his family history is like, his social history. Does he drink? Does he smoke? Has he ever done so? Has he ever used any illicit drugs? Sexual history. They don't always show that, but sometimes they do. And some vital signs as well. So first, think to yourself, what are the differential diagnoses here? Because when you start thinking about what the patient possibly has, that gives you a good idea of what to order for the patient or what to do for the patient. Then really think to yourself as quickly as you can, do I need to transfer this patient? In other words, is this an emergency situation or is it non-emergent? If it's an emergency situation, you would leave the patient in the emergency department. Or do you need to transfer them somewhere else, like inpatient, or have them follow up in clinic, or even have them go home? So on the actual case, you can click emergency department, inpatient, home, follow up in clinic, that sort of thing, to move the patient to a different location. And you can also move the patient to a different location during the encounter itself, depending on the status of the patient. Then ask yourself, if it's a very serious emergency situation, is there anything that this patient needs ASAP before the physical exam? Now, usually after you get the history of the patient, one of the very first things that you do, other than changing the location if necessary, is a physical exam. But if it's a very dire type of situation, like the patient is hemorrhaging out of control or cannot breathe, vitals look very off, then you might need to do something before the physical exam, as in put in some sort of order like intubation, mechanical ventilation, etc. But for majority of encounters, you would do the physical exam before anything else. Number 3, you would do the physical exam. So on the screen, it'll say hint, cardiovascular, pulmonary, abdomen, genitals, etc., etc. If it's a non-emergent type of situation, you would select the pertinent organ systems. But if you're in the emergency department or you're just doing a physical exam for the first time in clinic, you would select everything, including genitals. Even if the problem that the patient is coming in for has nothing to do with that organ system, those are the times when you would have to select all of them. And the results of the physical exam show up pretty much immediately after you click submit, and it'll show you the results, and you can skim through those very quickly and search for the abnormalities. Next, you put in the orders on the order screen. There are certain common orders that you would get for pretty much most patients, if not all of them, and I made a short list on a couple of them for you, just for your reference. You may not have to enter exactly all of those, but at least it gives you an idea of some of the most common ones. And you should also check the status of the patient, just to see how the patient is doing. Is the patient improving? Is the patient getting worse? It might be indicative of you doing something wrong if the patient is doing worse, or maybe that might just be the natural progression as the patient heals. Or is the patient getting better pretty quickly? That might indicate to you that you're doing something right. If the patient is not doing so well, it might also mean that you are forgetting an important order, despite having entered other orders that you think are correct. And just to note, you can order medications and other things, procedures, etc. throughout the case. So you can modify your orders too. For example, if you ordered IV fluids and later on the patient is doing well enough that you don't need to put the patient on fluids, then you can click cancel IV fluids, like normal saline. Or if there's a certain medication that the patient doesn't need anymore, you can cancel that too. Or you can add medications as the case progresses. But make sure that you enter the orders in the correct order. So one of the examples that I gave in another video was that if the patient is dyspneic and having trouble breathing, you don't want to order oxygen last. You want it to be one of your first orders because that's something that the patient desperately needs. You also don't want to skip important orders, even if you feel like you could just skip two because you can lose points. For example, if you want to order a chest CT, you have to make sure that you also ordered an EKG or an echocardiogram. I'm just giving you an example. And during the encounter, you can also recheck the physical exam. And if you're in the emergency department, you don't have to select all of the body systems all over again. You can just select a few of them that you want to check on, but just remember that the first time around when you first see the patient, you have to select all of the body systems. Now, here is a list of some common orders that I could think of. It applies to most patients, but of course you could give or take a few depending on the specific case. So you can first order pulse ox, the vital signs, blood gases, oxygen, IV access. NSS stands for normal saline, and you can actually type the abbreviated form on the order screen and it'll be just fine. CBC, CMP, lipid profile, TSH, all of that you can enter in short form as well. I like to order CMP instead of BMP because CMP also includes the LFTs, so you don't have to type that separately. If the patient is diabetic, for example, you can also order hemoglobin A1C. Check glucose also, like finger stick glucose. If you're suspecting that the patient's issue is related to the heart, and for example, if they're having an MI or something like that, you can order troponins, EKG. Cardiac monitor is also a common one. BNP, LDH. Usually when patients come into the emergency department, you can order a toxicology screen just to see if they've taken any drugs. You can also check a blood culture or urine culture if you're suspecting sepsis. Urinalysis is another common one to order for most patients. Acetaminophen, IV morphine to put the patient out of their pain. And usually if you're suspecting a coagulopathy or if it's a blood-related issue, or even if you're just prepping the patient for surgery, before the patient goes into surgery, you would order a PT, PTT, INR, and also type blood screen. So are they ABO, RH antigen, etc. You can also order type blood screen for if the patient is pregnant and she's giving birth, or there's some sort of fetal abnormality that's led to hemorrhaging, or something of the sort. That would also be a good one to order. And even if the history doesn't say that the female patient is pregnant, you still want to check beta HCG regardless. And if the patient is pregnant, then you can check the fetal heart rate and fetal ultrasound as well. Now, in some cases, you may need to send referrals and get consults from other specialties. For example, if one of your patients is homeless, you can go to the order section and type in consult social services. Or if the patient is suicidal, you can consult psychiatry, consult psychology. If the patient has some kind of neurological condition, you can consult neurology. Or you can even order the procedure that the patient needs, like cholecystectomy. You can either type in the specialty of the doctor you're consulting or the procedure itself. So just like the previous example, you can type in cholecystectomy, enter, or you could just type in consult general surgery, and in the reasons section, because it's going to ask you why are you consulting this specialty, for a reason for consult, you can just type in cholecystitis, comma, please advise. No need to have a period at the end or anything like that. Just keep it short and simple because you are being timed. You may also need to transfer the patient to another location during the encounter. For example, if the patient was present in the emergency department, but now their vitals are stable, they're doing pretty well, but you still kind of need to monitor them or give them something else like some other medications, then you can transfer that patient to an inpatient setting. Or if the patient is doing really well, there's no need for them to be at the hospital, then you can send them home with follow-up in clinic in 1 or 2 weeks. And at the end of the case, there's going to be a section for end orders. So basically all the remaining orders that you may have forgotten to put in, any orders that you want to get for the patient before they leave, or before you finish the encounter, any preventative measures that you want to add on, that is the time to do it in the end order section. And here are some examples of preventative orders that you can get at the end. So vaccines that the patient didn't get, and you know which vaccines the patient did not get, because in the history section, it'll say, got flu vaccine on maybe this date, or got XYZ vaccine on this other date. So Also, make sure you know the vaccination series. So, at age 65, which vaccination should I get? Or if the patient is a smoker, male at this age, should I order a chest x-ray or CT of the chest or whatever? So, just make sure you know that. Also, pap smears for the ladies if they're due for that. If the patient has been abusing alcohol, you could type in education for that. If the patient is a smoker, you could type in smoking cessation, education for the patient, and also reassure patient. That's another really common one for most patients. You have to reassure the patients at some point during the encounter. You can also do it towards the end, but again, it depends on the specific case. Sometimes you might have to reassure the patient ahead of time. Let's do a quick example case. So pretend you have a patient comes in, like 60-year-old, who presents with chest pain, and you read through the history, look at the presentation, the risk factors, etc., and you think to yourself, maybe this person had an MI. So here are some examples of orders that you can get for such a patient. Of course, the specific orders depend on the specific case, but this is just to provide you with an example of some things that you might consider ordering for this type of patient. And here's another quick example. Pretend that you have a patient who comes in with altered mental status. What are some orders that you might think of getting? Well, here are a few you might want to consider. Okay, so I hope you found that helpful before starting your CCS case practices. And if you have any further questions, feel free to comment down below, and I will try to get back to you as soon as I can. But also be sure to subscribe, like, and share my videos for more content. Happy studying!